Hi, my name is Benjamin Clapp. I'm a bariatric surgeon in El Paso, Texas. I'm originally from Texas. I was born in San Antonio, but I moved to El Paso in my senior year of high school. Kind of an army brat, been all over the world. I did medical school at Texas Tech, also in Lubbock, and that was in 2000 when I graduated. After that, I did my surgical training at Maricopa Medical Center in Phoenix, Arizona, in general surgery, which is 5 years, and then I did an additional year of training in robotics and bariatric surgery in Houston, Texas, at the University of Texas at Houston. Subsequently after that, I made my home back in El Paso, and I've been in practice now for 16 years here in my own solo private practice in El Paso, Texas. It sounds cliche, but surgery really is a calling. It's not really just a job. And, things are different and times change and generations change, but I think you still find people that are drawn to surgery today are people that see it as a calling and not just a job. It's a profession. You're not just punching a clock. You're not just going to work to get paid and so that you can do other things that you like. Most surgeons do have outside interests, and of course I have my own outside interests, but at my core I consider myself a surgeon. I think what patients find when they come, first of all, just to my office, is that they feel like they're coming into someone's home. This was someone's home. It hasn't been for quite some time. I bought it from another doctor about 10 years ago. But what I want people to feel like is that they are coming into a home where they're going to be welcome and where they're going to be treated like they were a family member, whether a cousin or an aunt or an uncle, or somebody that I'm going to treat like my family. And I think that's what I really offer for the patients. I kind of make a joke about it. It's kind of a mom and pop shop, but it's just the pop. I mean, but I do have my two ladies that I couldn't do anything without them. And I think that, they also are very friendly with the patients and make the patients feel very at home. I would tell the patient that's coming to my office talking to me about weight loss surgery, these operations are just a tool, and they're just a way to get people to get them back into a part of their life where they're healthier, where we can kind of reset their weight and kind of reset that part of their life. But if they don't use this tool, if they don't completely adopt it, if they're not aware of this tool, then long term they have the chance of going back into weight regain or weight recidivism and going back to where they were. The patient has to be ready in their heart and in their head. Nobody can do it for them and nobody can make the decision for them. But once they make that decision, they have to be 100% into that. The importance of talking to a patient partner mentor is that they have walked a mile in your shoes. It allows patients who are thinking about this to be partnered up with a patient that's already gone through this. But there's no substitute for talking to somebody that's actually gone through it that was in your shoes.